Hello, everyone. Today, we are going to talk about chlamydia and infections caused by this type of bacteria, what symptoms it produces, how to know if you have it, and what to do if you suspect you have this bacteria or once you have been diagnosed. Well, generally, it is treated by, it's not just generally, but it should always be treated by doctors. So, in order for a diagnosis to be made, you will need to undergo tests, which I will discuss with you later. So, what exactly is chlamydia? It is a sexually transmitted infection, STI. In the past, we called it a sexually transmitted disease, STD. But now we've changed the way we talk about it because it's not necessarily a disease that is transmitted. There may not be a disease, but it is an infection. So, chlamydia is actually a bacteria. There are several types of chlamydia. Don't think there's only one. The most common one encountered in STIs is Chlamydia trachomatis, but there are two other variants that can also be found, and possibly more if we go into more detail. So, this infection is problematic because its prevalence is increasing. More and more people have it. Why? Because many people, especially women and somewhat fewer men, are carriers without knowing it, asymptomatic carriers. So, they feel nothing at all. Since they feel nothing, they don't get tested or treated. And it gets transmitted this way. Of course, this infection is more common, as you might guess, in people with multiple partners who don't use protection, regardless of the type of practice. It can even be transmitted through oral sex, of course, if unprotected. So, you need to be careful. It definitely exists. Now, when someone contracts this infection, what will they feel in men? In men, it can be asymptomatic or cause, simply, tingling or slight burning sensations when urinating. You might feel that something is abnormal. It could burn a lot or just a little, but you'll notice that something's off. When urinating, you might also feel small stings afterward or during. This rarely happens at the beginning. Usually, when it starts, it's called a subacute urethritis, meaning it begins about a week after exposure. About 1, 2, or 3 weeks after the encounter with the infected person. Mainly, that's it. You might also notice some discharge from the urethral opening, where the urine exits, called the meatus, at the tip of the penis. The discharge can be pus-like, but that's quite rare. That's what it looks like in men. There can also be late complications, which are problematic because when complications occur late, especially if untreated for too long, they can lead to blindness. This can cause trachoma, which affects the eye. It's one of the most common causes of blindness worldwide, so don't underestimate it. These complications can also include inflammation of the testicles or epididymis, causing pain in the scrotum, even prostatitis, conjunctivitis, or joint pain. It can go quite far, but generally, when people are lucky enough to notice symptoms, it's just a tingling sensation. I'll tell you what to do next. In women, it's a bit more complicated because often women don't notice any symptoms. Or if they do, it's similar to men's symptoms, small, unusual discharges. They might not have a strong or foul odor, but it's possible. It can cause infections of the cervix, fallopian tubes, salpingitis, or even chronic pelvic inflammation. How do they find out? Often, women don't realize they're infected. But if anything abnormal or unusual occurs, they should get tested. See a doctor for a simple test, which is easy for both men and women. I just want to clarify that it can cause infertility, so it's very important. It can also cause chronic pain in the lower abdomen for reasons we don't fully understand. It can even lead to ectopic pregnancy, or if a woman is pregnant, premature labor. It's something that must be checked. When a woman wants to conceive, a full checkup is recommended beforehand, including a thorough urine analysis. That's very important, especially when pregnancy is planned, along with blood tests. So, how is the diagnosis made? Because, as you see, it's not easy to diagnose just based on symptoms alone. You can't be 100% sure. You need to do a urine test in the morning, the first urine stream, and send it to the lab through your doctor or a medical analysis lab. The results usually come back the same day, or sometimes it takes a bit longer to culture the bacteria. It can take 2, 3, 4 days, depending. If it's positive, it's not very serious. The treatment is quite simple. Usually, 2 pills are prescribed. It's a medication called azithromycin. Azithromycin is an antibiotic from the macrolide family. So I tell you this, but of course, you should see your doctor because everything depends on the case. Other treatments can be prescribed, but generally, this is what doctors currently give. If you have any questions, don't hesitate, and I will make other videos about different possibilities because, of course, we will go into more detail about other symptoms that can point to specific causes. That's it. Thanks. See you soon. Have a good day or evening.